All of my career, I've spent not just being a practicing neurosurgeon, but doing work that relates to advancing women, especially in areas where women are underrepresented, such as neurosurgery. And so I have a long track record of doing work in terms of establishing organizations, promoting women, doing research related to how to advance women in that area. And so I was approached because of that work, and particularly a couple of the projects that I've worked on in terms of recruitment and retention of women in neurosurgery, and work that relates to the history of women in neurosurgery and how our organizational structure led to women really making fairly rapid advances in neurosurgery. And then most recently to work I did on identifying sexual harassment within the world of neurosurgery. So I think, first of all, I think when people collaborate and they work together as opposed to, working in small silos, I think everybody wins. Our patients win, doctors win, we have better career satisfaction. And it's not just for the women, it's for the men within medicine as well. And when you uplift one group that's a part of diversity, I think you uplift all the groups. And so I think every opportunity we have to share the lessons we've learned, and to bring others along and help support them, I think that's always, really, really positive. So, I mean, I have worked like across the Cleveland Clinic, and I have I've done a lot of work in terms of leadership development and mentoring for women across the enterprise. And that's really exciting to have that kind of collaboration. And this is another level of collaboration where I can bring my 30 plus years of experience, kind of fighting the good fight and learning the things that work and the things that oftentimes don't work, in order to have women do better, our patients do better, and to have a better sense of career satisfaction, which I think is important. I think what I'm hoping to deliver with my keynote address is to use my story and the things that I've experienced, the highs and the lows, to give other people a sense of connection. When I gave a similar talk here at the Cleveland Clinic, there were so many people who nodded their heads and said, "Oh, that happened to me," or "I felt that way, and I never thought about it, or I couldn't put it into words, or it didn't occur to me that made it harder for me than for my male colleagues," and that sort of thing. And so I think that with the benefit of having, been in practice for 30 years, I feel that I have the freedom to speak about the challenges in a language that will really resonate with a wide spectrum of women. I use a lot of storytelling to really demonstrate the challenges that we face and our need to come together and find, solutions that work for all of us.